Hi, I'm Dr. Ahmed. I'd like to talk to you about Morton's Neuroma. Morton's Neuroma is a thickening of a nerve on the bottom of our foot towards the forefoot. This involves the nerve that's located between the third and fourth toes, and it can happen in either foot. When this happens, it's usually due to repetitive stress and pressure over that nerve, and this can happen due to multiple issues. Patients often describe symptoms including pain, burning, tingling, numbness, or sometimes feels as if they're stepping on a pebble on the forefoot. Sometimes the pain may radiate between the toes as well. Some of the causes of the neuroma can be due to improper footwear, improper mechanics or anatomy, which typically involves a good evaluation by a specialist, or sometimes repetitive stress in that forefoot, potentially due to in athletes, that can lead to increased pressure over the nerve in the forefoot. Conservative management typically involves decreasing the pressure primarily over that nerve, sometimes with paddings underneath the forefoot, as well as working on possibly decreasing the tension if there's potentially a tight Achilles involved. It can involve evaluating your shoes to make sure that you have proper space within the forefoot part of the shoe, which is called the toe box, as well as making sure your mechanics are properly evaluated and treated to ensure that you don't cause increased pressure underneath the forefoot. Also, if the pain is significant, sometimes a steroid injection or anti-inflammatory medication can be utilized to help decrease your pain. Surgical management can typically involve either a nerve resection of that small pebble-sized nerve, or possibly releasing the fascia in between or on top of the nerve to help splay the two bones along the side of the nerve and actually help decrease the pressure over that area. Majority of neuromas, if caught early and treated early, can be treated conservatively, and surgical management is typically left as last resort, and majority of the time it's not needed. If you're experiencing any of these symptoms that involve potentially a neuroma, come and get evaluated. Early evaluation often leads to simpler and more effective treatment. We look forward to treating you and offering a good relationship between patient and doctor to get you pain-free and walking.